Hello, Farmer Pro family. Today we'll be discussing an important topic: understanding syphilis. Syphilis is a bacterial infection caused by a motile spirochetes Treponema pallidum. How is syphilis transmitted? Syphilis is transmitted through 1. Sexual contact, 2. Blood transfusion, and 3. Transplacental transmission. That's from mother to fetus. Signs and symptoms of syphilis. There are 4 stages of syphilis, and each stage has a different sign and symptom. So the primary stage is number 1. This stage is usually associated with the appearance of a single or multiple sore called chancre, usually at the site of exposure. These sites include vagina, penis, rectum, and lips. These sores usually go unnoticed because they are painless, as seen in this picture. At number 2, we have the secondary stage, and this stage is associated with rashes, which might not itch, and the rashes also affect the palms and sole of the feet. It's often rough and reddish brown, and this could also go unnoticed. Now, if you look at letter F, you see that's the sole of the feet. You see how the rashes are looking reddish brown. At number 3, we have latent phase. This phase is usually asymptomatic too, and the syphilis infection can last in the body for years. If you have listened so far, you see how a lot of these symptoms are going unnoticed. At the first stage, we have tertiary phase. This is the most serious phase of syphilis when it is left untreated. This phase can last from 10 to 30 years after syphilis infection, and this phase can cause damages to the internal organs and even result to death. Now, how do we test for syphilis? Treponema test, which measure the antibodies to Treponema pallidum, and we have the non-Treponema test. We also have rapid test method, and then the treatment for syphilis includes the use of benzyl penicillin intramuscularly, and when there is resistance or allergy, it is advised that you use doxycycline or ceftriaxone, and in special cases, azithromycin should be used. What are the advice to patients? You advise them to practice safe sex, get tested regularly, and inform their partners so that their partners too can get treated. Then also, you advise the patient to get complete treatment. Follow-up too are important. Most times when people come to treat syphilis, they come alone, they don't inform their partners. Now, as a healthcare workers, what do you have to do when dealing with syphilis? Wear your protective equipment, avoid contact with the lesions, and use sterile equipment. Also, follow the infection control protocols, and then report occupational exposure immediately. Remember, your safety first. If you find this information helpful, don't forget to like, share, and subscribe for more. Thank you.